Do you ever feel pain in your Achilles tendon? Maybe it hurts to jump or when you're running, or sometimes in those first few steps when you get up out of bed in the morning. Well, that's exactly what my patient today, Ling, has presented with. And today I want to show you how I treat this injury using only fascial scraping or graston technique. So the first area we want to treat on Ling is the calf. So the calf is made up of two major muscles, the gastrocnemius and the Soleus, and so we want to work into that. The reason working into these tissues is so important is they come down and actually create the Achilles tendon. So that's where we get a lot of sort of, if the calf is tight, a lot of sort of pulling through the ankle. And that excessive pressure over time degrades the tendon and leads to injury. So it's not something that you'll generally get with a one-off. This is something that builds up over time. Now, the soleus muscle is generally engaged when the knee is flexed. So I'm mainly working on that muscle in this position, and we'll get the bulk of it through this muscular tendinous junction here. And we're sort of, you can see we're doing quite broad strokes through it. It is a big muscle to work through. And you can see Ling sort of bouncing around a little bit. It's not comfortable. If you've got an Achilles problem, there's a high chance that this is an issue for you. Once we've sort of done a few minutes through that, the next we want to work primarily on the gastrocnemius. And because that one activates more when the muscle, the leg is straight, we treat it in that position as well. Exact same sort of technique. I'm using the big handlebar one and working up through the bulk of the muscle. And as I do this, I'm feeling for almost like a gritty sensation. And for Ling, it's really through that outside lateral head through here. The next muscle that I want to address that has a huge role on the ankle is the perineals. So this muscle goes from the fibular head, which is this long bone down here, comes down behind that ankle bone and attaches into the side of the foot. It is one of the primary stabilizers of the ankle. Now, if this, isn't working properly, it will change how the load is distributed through the ankle and can cause more tension in the calf and then eventually into that Achilles tendon as well. When I see this muscle become dysfunctional, it's usually from ankle sprain. So an inversion sprain is where you sort of come this way. The main thing that gets irritated is the ATFL, a ligament through here. But then if it's a really nasty one, it'll affect the tendon of this perineal muscle too. So for Ling, I'm working through here. I'm not actually feeling that gritty sensation that I felt with the Soleus. There was a lot more tension for him on that one. So what we want to do next is look at the next muscle, which is almost the opposite to this. It's the other stabilizing muscle on the inside here, the tibialis posterior. But to do that, what we might do is get Ling to turn over onto his back. Now, the tibialis posterior, it actually comes deep under the shin bone, and that is sensitive for Ling. This is a big player for his pain, I would say. So this muscle from here, behind the bone here, and into this. Its primary role when sort of running and walking, that sort of thing, is to control how the foot pronates and lands. So you'll find that if this is dysfunctional, you'll be more of that slat foot type roll. So to treat this, I use a different tool. This one, you sort of have these hooks on it. So you can come in under the bone and work all through that. Now, generally when I treat this muscle, I'll sort of work down it and I'll find one gritty area. But for Ling, it's the whole damn thing. This is really, really nasty for him. And I don't think he's enjoying this one at all. But I know that this is going to have a big effect on how his ankle stabilizes and ultimately how much force and load is going through his Achilles tendon. Once we've spent a bit of time through that muscle, the next thing I want to do is the plantar fascia, so under the foot. The reason being, the calf, the gastrocs, the soleus will come down, create the Achilles tendon, and then wrap under the foot. So really, if either the plantar fascia or the calf is tight, this is the friction point, and this is where you're going to get damage to the Achilles tendon. So we want to make sure that we work on this. So again, maybe we're going to turn Ling over. We'll pause there. Now, for the plantar fascia, I like to use a sort of thicker tool so we can really work into that. The main area that I'll see will be just here. That is where you'll get most of the tension build up. That's not always the case. You still want to feel up around some of the other areas. You've got a muscle here, the abductor hallucis brevis, that can take a lot of load through there too, especially if his tibialis posterior is poor, causing an overpronation. So I can actually feel on him there's tension through there. So I'm hitting plantar fascia as well as that muscle controlling the big toe there. And if we really want to get more tension in there, we can create stretch through the tissue. Pull those toes back, dorsiflex the ankle. Now, for the final one we want to work on is we definitely want to actually address the Achilles tendon itself. And now for that one, I'm going to use the hook tool again, the same one that we used for the tibialis posterior. And then we can sort of come in. I like to put the tissue on stretch, dorsiflexing that foot. Now when you do this, it shouldn't be creating too much bruising. It should be like it should hurt a little bit, but it's not going to kill the patient. Tendons will have a different sort of feel to it. And for him, there's just one point right in the middle there that I can feel it's quite thickened up and just needs a little bit more work. So once you've done this a couple of times, maybe had a couple of treatments of this technique through here, if you're not getting changes, sometimes a more aggressive approach would be required. If that was the case, I would be dry needling up through the Achilles tendon. We'd also need some exercise therapy on it, so training this tendon under load. And if we're still not seeing a change, look at his hip control, the hip stability, glute medius, max, maybe his core, and identify, is he getting enough hip extension power to propel himself when jumping, landing, things like that, to make sure that this isn't doing too much work. We are getting some power through here as well. Now, if you've enjoyed this video, I've got another great one about knees that I'm going to link for you to watch next.